Sure. My name is Michael Melnick. I'm the VP of User Experience for Klick Health.
Give us the brief overview of the solution or the talk.
Mm-hmm.
So the solution.
A solution. Yeah. So Klick, and together with the American Medical Association, came up with an online platform called Steps Forward.
Mm-hmm.
It was a platform that was meant to enable physicians to run more effective and efficient practices.
Mm-hmm.
It was meant to address the issue of physician burnout and the fact that they were leaving practice and they would not recommend it to their kids or their grandkids,
Mm-hmm.
which causes a huge threat to the health system in the U.S.
So what are some of the top reasons that physicians are getting burnt out, other than the obvious? They're working long hours.
Yeah, so they end up working long hours because they're mired in data entry. So instead of physically talking face-to-face to patients, they actually have their backs to them more often than not. And this is causing a huge burden in terms of time. And they're working longer hours and not getting home to their families and spending longer hours in the office as a result.
And so your solution is an online educational platform.
Mm-hmm.
What are some of the key tenets of this platform that make it successful or unique?
So the platform itself was nothing like has been seen in the physician space. It was designed using some consumer design patterns that physicians just aren't used to seeing. So what made the solution different was that we weren't deploying any stock photography or anything like that. It was genuine quotes, genuine video case studies of practices that had implemented some of these ideas in their practices and wanted to tell the stories so that other physicians can benefit from them. And the online platform really leveraged a lot of design patterns that we've seen in the more modern consumer space that haven't been leveraged historically on the physician side. And that made the site much more engaging and interesting for physicians to interact with.
So you started using empathy as a channel for other physicians to feel like they're not alone.
Mm-hmm.
What are some of the other techniques that you're using for them to ease their stress?
Exactly. So physicians are often, they respond to data, hard data. And so what we did as part of the website experience was we implemented these calculators, the interactive calculators that demonstrated the value that a physician would get from implementing a module, whether it be time or a return on investment of the impact that it would have on their practice. So that was one of the areas that we talked about. Another area is demonstrating success stories through case studies from other practices that have implemented similar ideas in their practices to great success.
So Kaiser has a sort of online system that their physicians use. How do you guys compare? I mean, that's mostly for prognosis and diagnosis. How is yours different?
Yeah, so, I mean, based on what you're describing, it sounds like it sounds completely different. Our system is focused on running practices more efficiently, and the focus of this, they are primarily the physicians, but it's also the practice managers that are implementing change, modernization, innovation within practices, so the day-to-day operations of the practice.
So what are some of the results of how they're taking that, and are they just simply kind of cutting and pasting and using what they see online, or have you seen other really innovative processes that they've tried to implement?
So physicians are typically traditional in that they're using a lot of paper-based assets, and we're trying to move them more into the digital space. So what we're offering is customizable downloads, PDFs, Word documents, PowerPoint presentations. What we're trying to do is minimize the friction for physicians to implement modules, and by doing that, we're enabling them to more seamlessly integrate more modern practices into their practice.
What's some of the feedback that you've received from your customers so far?
The feedback has been universally quite positive. Physicians that have engaged in the platform are very likely to implement the modules. The AMA has been holding in-person events across the country, and the feedback they've gotten from physicians has been very, very positive, and the following of Steps Forward has actually grown quite a bit. We've gone from 4 modules at launch to over 50 of them now, if you visit the website. So massive success. I can also tell you that the Steps Forward program has been recognized by U.S. Congress as an approved activity for physicians, and so that's pretty empowering and pretty impactful.
You should be very proud.
Yeah.
So as a VP of UX, do you have any comments or suggestions for other UX organizations on a similar path? Whether it's just getting a product implemented or research process, anything that's really important about how you have found success with this product and at your organization?
Absolutely. I think practicing humility is a big one. We don't know all the answers, and part of the job is figuring out not just the answers, but the problem. And so stepping back consistently and reframing what it is that you're doing and why is a really healthy technique that we find is very effective.
Have you been to the UX Awards before?
I have not.
It's your first time?
It's the first time.
Are you from Bay Area?
No,
Yeah.
from Toronto, Canada.
Toronto, okay. What do you think of the award show so far?
It's been great. I'm so energized by the growth of the UX practice that I consistently say to people that the world needs more user experience love, and to be part of an event like this has been empowering and inspirational, and I'm just happy to be part of it.
Were you a designer?
I was, yeah. It's
a UX designer?
yes.
Oh, okay, cool.
Yeah. I mean, not self-taught, grown through it over the last 10 years or so.
Yeah.
In my position, I don't get too involved in the projects anymore, which is somewhat unfortunate, because that's why I actually loved the practice.
Yeah.
But the combination of art and science was really appealing to me.
There have been many perspectives that have been expressed around the future of UX and where we are today, where we're going. Do you have any of your own personal opinions about our industry?
So what I'm seeing is a lot of innovation around the research side, whereas historically we had to fly to a research facility, recruit, get people into the lab, talk to them. That's still kind of the Cadillac and the standard, but we're seeing a lot of breakthroughs and innovation in that space that enable us to run research activities much more efficiently, lower cost, much more quickly, especially in the mobile space. So in terms of the future of UX, the availability of tools like that will make it easier to involve end users in the design process. And I think that'll have a big impact on the quality and the output.
Okay. Any projects that you're excited about or to see or have seen today?
Yeah, absolutely. I mean, I'm really energized by the use of novel technologies, by VR. I haven't seen too many voice. I was expecting to see more about that, but I'm sure we will in the coming years. VR, I think, is at its nascent curve in terms of adoption, and there's a lot of excitement around it, but people often see it as the solution rather than just an enabler and a piece of technology. And so I think that as the years progress, we're going to see more problems being solved through VR. And the same goes for AR as well. I think there's a big future there too.